All right. So, not in the real world, but in the real world and in the test world, you need to be aware of residual confounding because residual confounding is a big deal. Um, how do you treat iron deficiency anemia? Oh, okay. So, treatment of iron deficiency anemia will result in an increase in reticulocyte count first. That's what you were getting at. Okay. What is like one of the main ways to treat pelvic organ prolapse in a female? PESA replacement. Should you allow your pregnant patient to go scuba diving? Definitely not. No scuba diving for you, and no sort of like intense stuff, obviously. Um, if you suspect someone has metastatic cancer to the spinal cord, what sort of medication should you do and what sort of imaging? Yep, immediately high dose corticosteroids and an MRI of the spine. Um, True or false? The power of attorney takes precedent over next of kin. Oh yeah, that's definitely true. You dealt with that on a day-to-day basis. You know. If someone comes into your ER with PCP intoxication, what should you give them? Lorazepam. You don't want no crazy folks around there. Lorazepam, friends. All right. Um, NP, what should you think? Acute neuromas and schwannomas. Sorry, that's NF. Neurofibromatosis. Think acute neuromas and schwannomas. And by the way, there's two of them. You should know which one that goes with. Um, what sort of incontinence does someone have if they urinate on themselves after a sneeze or like bearing down? Overflow incontinence. Can kids with HIV attend public schools? Yes. How do you calculate relative risk reduction? Well, it's risk in the exposed minus risk in the unexposed divided by all that, divided by the risk in the unexposed. What epidemiologic thing is a measure of strength of association? Relative risk. Can you read a rock curve? Definitely. And what are the axes? Sensitivity is the y-axis, and 1 minus specificity is the x-axis. If someone wants to take isotretinoin and they're a female of childbearing age, what sort of test do they need? They need 2 negative pregnancy tests before you can even think about giving isotretinoin. Typically, do you want to screen someone for PTSD? Yeah, yeah, you do, if under the right circumstance in the question, for sure. PTC, status post surgery, and RT, increased levothyroxine to get TSH low normal. Okay, you see what that line of thought was. I'm gonna say it again. PTC, that's a type of thyroid tumor that you should know, and you do know, because it's the most common. So you have to know that. So you have that status post, intervention, surgical and radiotherapy. There's increased levothyroxine to get the TSH low normal. Now you got that. Now you know. Okay. If a old man, not old, has BPH and he can't urinate, what's the next step? Right, catheterization. If someone has a bullous skin disease, where do you want to get the biopsy from? From the skin edge, right? HIV pneumocystis jirovecii, if the CD4 count is below what? 200 millimeters cubed, or 200 per millimeters cubed, right? AA oxygen gradient greater than or equal to 35 millimeters mercury is an indication for what? corticosteroids, right? Understand when you need to do a bronchial alveolar lavage. And basically, 9 times out of 10, you want to start the statin under obvious scenario. If a patient wants to leave and they're mentally with it and understand the risks and benefits and all that jazz, do you want to respect their autonomy? Definitely, but follow up or tell them to follow up if they change their mind. Hcp Repeat Tb Test. Healthcare personnel should repeat the TB test if they're exposed to active TB. If a pregnant patient is in your OB/GYN clinic and she has an asymptomatic gallstone, is it a big issue? No, it's not. It's asymptomatic, so just reassure her. If someone has a weird surgery, e.g., or if someone wants a weird surgery, like your patient wants a female circumcision for herself, you basically, although you think it's weird, tell her, it's your decision, but I would like to review some complications with you, okay? Now let me tell you this. Little baby has jaundice, been sucking on the teats, and it started about 3 to 5 days and peaks in 2 weeks. What sort of jaundice does this little baby have? Breast milk jaundice, right? And if the baby has breast milk jaundice, it's fine. Just continue feeding breast milk. They'll eventually get over it. You know about a patellar tendon tear. That is crazy. You should YouTube it because I'm sure there are some things that you would see. Do you need a surgical repair for a patellar tendon tear? Yeah. If you want to walk, you're gonna need it. How do you treat premenstrual syndrome? Well, one, you can use an SSRI, and then the second line would be another SSRI or an OCP. And I guess the third line would be a gonadotropin releasing hormone agonist, right? Now, does premenstrual syndrome increase the risk of a certain psychiatric issue? Yeah, depression. Premenstrual syndrome increases the risk of depression. How do you treat intussusception? Ideally, an air enema, right? Air enema. And a kid at the ER needs life-saving care, so do you need to get informed consent to treat on them? No, proceed without it. I mean, it's nice to have if the parents are there, but if they're not, what you gonna do? You gonna let the kid die? Of course not. So you're gonna treat him. Acute pain after an enema, reduction of intussusception, you need to get an abdominal radiograph to rule out intestinal perforation, right? Right. So if a person has an acute pain after an enema reduction of intussusception, so this is going to be a kid, you want to get an abdominal radiograph to rule out a perforation, an intestinal perforation. Is blepharospasm a form of focal dystonia? Yes, it is. And how do you treat blepharospasm? With a botulinum injection. What sort of stenosis is present with rheumatic heart disease? Mitral stenosis, right? Mitral stenosis is present in rheumatic heart disease. If a patient is bipolar and they have induced mania, what do you want to do with them? You want to discontinue the SSRI and bipolar induced mania. If a patient with severe mania, what medication should you use typically in combination? Lithium and valproate. If a patient comes to your clinic and you notice that they have a marfanoid body habitus, what sort of imaging do you want to get? Get an echocardiogram. And also be aware of the risk that they may have a brain bleed risk in the future, okay?